Hey there, my name is Megan Clanahan, and I am the co-owner of Houston Moms Blog. And during this, difficult time and stressful time, we are determined to bring you resources and valuable information right to you. And we couldn't think of better partners than our longtime friends at Next Level Urgent Care. And so we're going to be sharing some really important information today that I think us as mamas and us as parents really need to know. And I am thrilled to welcome Dr. Robbyn Traylor to our conversation. She is the Chief Medical Officer of Next Level Urgent Care. She has been there for 6 years. Next Level Urgent Care it has been in business for 7 years. Dr. Traylor, how many locations do y'all have now?
Today, we are operating 14 brick and mortar urgent care clinics, and we also have a virtual clinic that's available to patients during our normal operating hours.
Perfect. And you know we love y'all. You have been at our Bloom events. You've spoken to our new and expectant mamas. And so thank you so much for joining us. And we really just during this time wanted to find out what Next Level Urgent Care is doing to protect the community, keep us safe, and keep us healthy. And so if we could share a little bit about what that looks like for your day-to-day operations right now and what safety precautions that you're taking for our community, because you're, from Northwest, East, South, right?
That's right. We do have a fairly large footprint around town, Megan, and thank you so much for inviting me to talk to your readers about Next Level's response to the COVID-19 pandemic. I think it's obvious that the entire globe has been impacted by this pandemic. There's not one life on this planet that hasn't been affected by it. I was forced to kind of reflect on where we've been in Houston over the last couple of months while dealing with a novel 2019 coronavirus. And it looks like the very first case in the Houston area was diagnosed around March 4th. And we know at Next Level that we actually evaluated and treated some of the very earliest cases during, within that first 10 days of March when we were starting to get little blips on the radar. Today in Houston, we have more than 15,400 cases, which is really kind of amazing when you consider that our city has only really been dealing with this for a couple of months. Yeah. Impact has been major. Next Level has really had to be very nimble and creative and figure out ways to keep our patients safe, but also to keep our team members safe. So one of the things that we've had to do is really be very creative about how we source personal protective equipment. Everybody's talking about PPE in the media, and many of us had never even worn a mask before. If you're not in healthcare, maybe you've never even worn a surgical procedure mask or an N95 mask. In fact, in a building where I frequent, one of the security officers asked me, how do I even wear this thing? And I gave her a quick tutorial on putting that on. Getting PPE has been more challenging because the whole world needs it. All the healthcare workers need it around the globe. And we could tell, say February going into March that it was going to be really hard and really expensive to get the disposable masks and gowns and gloves that we're used to having. Just to give everyone reference, a couple of months ago, pre-COVID, getting one N95 mask cost us about 50 cents. Today, one N95 mask costs about $8. Okay.
Wow.
Yeah, I mean, it's really outrageous. Or, one of our disposable isolation gowns pre-COVID was about 43 cents. Today, that same gown is about $11.50. So there has been an incredible markup on those kinds of supplies. But, despite that, we really don't have a choice. Like, number one, we knew from the beginning we were going to have to respond. People depend on urgent care and certainly on next level urgent care specifically as one of the very largest urgent care providers in the Houston area to be ready. And we've learned, in this pandemic that our friends and neighbors are willing to extend, some forgiveness for process changes here and there, but really, people expect professionals, healthcare professionals, to be professional and to be ready. And so we have always worn our PPE to evaluate and treat patients, not only so we remain safe and healthy, but so that every single patient that we encounter remains safe and healthy. So, that's just one of the things that we've done. Another measure that we had to take in mid-March was really just turning our clinics inside out. Now, Megan, I know, you must know a person or two who's visited Next Level. Right. Well, and yeah, no one had ever had an experience being evaluated in our parking lot. But I mean, and really it just, if you're Southern, if you're Texan, it almost seems a little bit inhospitable, to not invite people into your clinic. We pride ourselves on being very friendly and welcoming and
Comfortable.
I'm telling you, but with this virus, we had to pump the brakes and really go deliver care outdoors for pure safety. Because again, our team members needed to remain safe, and we need to be able to see patients outdoors in open air so that we were not trapping and isolating droplet particles in the air inside our clinics. So there was that, but then also we figured out that we were going to have to do some testing outside also.
Are y'all still doing the testing outside? Is that still happening?
We are still doing drive-up testing, and patients with higher risk symptoms like fever and productive cough are still being evaluated outdoors. Now, we are doing what we can to bring people inside who do not seem to have those high risk symptoms. And certainly people who don't have any infection related complaints we're bringing in.
Like the kid fell out of the tree.
Right, absolutely. Absolutely, the kid fell out of the tree, or even, sneezing, according to CDC, is not necessarily considered a high risk symptom. And, it's springtime in Houston, everybody's sneezing. Someone with itchy, watery eyes, is probably dealing with allergies right now and not necessarily COVID. People with ear complaints, we're happy to bring into our clinics. Now, it is right now, the governor is mandating that when patients come into our clinics that they have to wear a mask. And, we fully support that. So we ask our patients to bring their own mask, but if you don't have, of course, Next Level will provide you with a mask. We have hand sanitizer, and we work diligently to keep all surfaces clean. We have all kinds of social distancing measures and walkways built into our clinic infrastructure so that patients can feel really safe and confident when they're walking into our clinics.
Well, and I will say, not to interrupt you, Dr. Traylor, but
no.
As a long time patient of Next Level, I feel like I need the swipe card, frequent flyer swipe card, because I have, 2 kids. They're twin, almost 10-year-olds, and a husband who has gotten hurt. I've gotten hurt or sick or what have you. But I have always felt like your clinics have taken incredible measures. I never felt like it was yucky walking in to pre-COVID. So I can only imagine what it's like post-COVID. But so to your point about the mask, so you you are okay if people bring the cloth mask. If they don't have them, then one will be provided. But it's okay if they like, because I have like that handmade one. Is that okay?
That's right. That's right. Any mask is fine. In fact, the CDC website doesn't specify what type of mask. It's just recommended that people wear a mask. And so
Okay.
if you have a mask, that the idea is that something's better than nothing. Now,
Right.
all of my team members are going to be wearing their N95 masks, and some you may see in surgical loop masks when we're dealing with people with non-infection complaints. So rest assured, you know, every next level team member will be masked, but patients who don't have a mask, it's okay. We're going to take care of you, you know, and we have a mask for you when you walk in and need to be evaluated. On that note, though, right now in our clinics, we are asking for patients to come in by themselves. Of course, if a child has to be evaluated, of course, you know, their parent is welcome to come in and be present for that evaluation. But again, you know, pre-COVID, sometimes families would come in for moral support. Everybody's interested in the health and wellness of the affected family member, but right now we cannot allow it because of infection control measures. So right now we're just asking patients to bring themselves so that we can take care of you and get you out of the clinic safe and healthy.
I love that. And what is the best way for them to get into the clinic? Because what I have always used and what I love, and I assume you guys are still doing, is the online check-in, right?
That's absolutely right.
You go and put yourself in the app, and then they text you if you prefer, or I think they can call if you want to, that your room is ready. And then you just go. And I've always preferred that anyway, because I didn't want to like necessarily sit in a waiting room. So, but is that the recommended course of how to get seen?
Well, see, Megan, you're a pro. You know, you already gave the rundown on instructions for registration at Next Level. But yes, talking about our app is honestly one of my very favorite subjects. So if you want to be seen live in one of our brick and mortar clinics, you would very simply download our free Next Level Urgent Care app, and you can get in line by clicking the top button. The app will tell you which clinic is closest to where you are. So you have some ideas of what's convenient to your present location, but you know, if you're going to drive across town, maybe you want to go to that other clinic, it's fine. You just scroll through and pick the clinic where you want to be seen.
Okay.
Go ahead and answer some simple registration questions, and yes, we'll text you when your room is ready.
It's awesome. And I mean, if I recall, you can even put in, you know, why you're being seen.
That's right.
You're being seen, insurance information, and then.
That's right. That's right. In fact, another really cool feature of the app, which I love, is that we can register our friends and neighbors. So I've had neighbors call me up and say, hey, doc, you know, I'm not feeling too great. I was hoping I could get seen in your clinic. And, you know, for the ones who don't already have the app on, I can go ahead and put them in line myself and register them. I'll put in their cell phone number, and they receive the text from Next Level. So you can be helpful to someone you love if they need a little bit of help.
Little tech assistance.
That's right. And really, you know, we think it's important. I mean, like our most valuable commodity is our time. And we don't think that patients want to hang out in the waiting room for a patient room to be vacant. And so it's much better for you to be able to wait from the comfort of your own home or wherever you are. Mm-hmm. And when your room is ready, we'll let you know, and you just come over and walk right into your room. Another option for being seen is our virtual clinic. We actually created our virtual clinic in mid-March in response to COVID. Because we knew that lots of patients were going to want testing, but that also some patients just were not going to want to come in. You know, if you have a simple issue that's non-respiratory related, you know, some people were getting a little bit nervous about walking into the clinic. They didn't want to get sick. So Right. They didn't want another thing to happen, you know, while they were seeking care for the original issue.
Absolutely. And I can't wait to talk about that for our next week's segment, because we're going to do this again so we can chat about what the virtual visits look like versus like an in-person, and how to know when you need an in-person versus virtual. So definitely tune in next week. So we can, we're going to chat about all of that so you guys can make informed decisions. So until then, Dr. Traylor, always such great information. It's great to see you. And we appreciate all that Next Level Urgent Care does for our community. Encourage you. We're going to post in the comments and the links below different blog posts that Dr. Traylor has written that can help you during this time. And then even, I mean, just like allergy posts. She wrote like a great allergy post like a year ago, and I'm struggling with that a little bit. And I'm going to go revisit that one. I hope you guys will as well. And then again, just to make sure you go to their website, get that app on your phone, or help a friend get the app on the phone. And we fully entrust our family's care with Next Level Urgent Care. And we're privileged to have you as a partner. So thank you, Dr. Traylor.
Thank you so much. Thank you for that compliment, Megan. It's been a pleasure speaking with you today.
Absolutely. And we'll see you next time.